One of the most critical aspects of healthcare, health emergencies, and disease management is respiratory care. That's why we want you to know about the American Association for Respiratory Care, the leading national and international professional association for respiratory care. The AARC encourages and promotes professional excellence, advances the science and practice of respiratory care, and serves as an advocate for patients and their families, the public, the profession, and the respiratory therapist. The respiratory therapist is one of the most critical members of any healthcare team. They work closely with doctors to diagnose, treat, manage, and educate patients with chronic respiratory problems like asthma, emphysema, COPD, pneumonia, cystic fibrosis, pulmonary fibrosis, as well as cases involving advanced life support technologies. The AARC also has a philanthropic arm, the American Respiratory Care Foundation, a not-for-profit organization that supports respiratory research, education, and charitable activities. The ARCF is deeply committed to health promotion, as well as disease prevention and management, and they've had a tremendous impact on the respiratory care profession. Since 2000, the ARCF has provided over $1.3 million for education of respiratory therapists, which includes more than $350,000 in direct scholarships and achievement awards. These awards go to respiratory therapists who have demonstrated leadership in their field. They've also provided over $250,000 in support of original research. And they publish and help fund respiratory care journal conferences, the most important publication covering the science of respiratory care. In its efforts to globalize the respiratory care profession, the ARCF also supports several international programs like the International Fellowship Program, where non-U.S. healthcare professionals are given an opportunity to visit the U.S. and observe respiratory care as it is practiced in the U.S. As with anything, a historical perspective of the past often can provide a unique and clear understanding, not only of the present, but also what lies ahead in the future. So the AARC and ARCF have launched a landmark project, a virtual museum of the respiratory care profession and the respiratory therapist. It provides an online look at the birth, growth, and history of the profession, the technology, milestones, and the people that have shaped the profession over time. You can visit the virtual museum at museum.aarc.org. The AARC and the ARCF are grateful for the indispensable support of their donors and sponsors. We invite you to visit arcfoundation.org today and consider making a donation to this great organization.